Typically this time of year, the call for flu shots goes out, but the flu isn't the only health threat facing us. In part one of this two-part episode of ASTA, we'll address the health of Las Cruces. Hello and welcome, I'm Udelvy Hill. Our guest for this edition of ASTA is David Morgan with the State Health Department. David, thank you for joining us.
Thank you for having me. There's a lot to talk about in the public health realm.
We've got a lot, and you've been pushing out a lot of good information about all the health issues that we're facing throughout the state, but we also want to kind of talk about what's going on here in Las Cruces.
Absolutely.
So, in addition to the flu, and, we always get the call this time of year to go get your flu shot, and which I already have.
Well done.
Yes.
Very good.
Well, I was at the drugstore for something else, and I figured, hey, I'm here, might as well get it done. And they got me in and out lickety-split.
There you go.
It worked out well.
That's my afternoon plan. We'll see how that goes.
Okay, great. All right, so we're going to be talking about the flu, but there are other health issues such as vaping and meth and mumps and hantavirus and West Nile virus,
right?
That we're gonna discuss. But let's start with the flu and the fact that yes, we need to go get vaccinated for the flu and how important that is. But how many types of flu are there floating around out there?
There are multiple strains, but in terms of kinds of flu, we're talking about 4.
Okay.
And then there's different substrains, but the 4 real main types of flu are types A, B, C, and D. Isn't that clever how they came up with that?
Easy to remember.
Easy to remember. C will give you a minor respiratory infection, easily treatable, not a problem. D usually just affects farm animals. It's not contracted to humans. It's A and B that kicks us in the United States every year.
Okay.
So in our case, flu season doesn't really start until mid-October. We're early, but the opportunity is already there to be able for residents to be able to get flu shots, whether it's from their general practitioner, their local drugstore. Our public health clinic, for example, here in Las Cruces, offers the flu vaccine. But then there's also the annual Boo to the Flu event that we do every year. Mm-hmm. I hope folks in the audience are a little familiar with it because for multiple years now, we've had both local hospitals, both major local hospitals in the community working together on this. We're talking about something that is happening really just the same day, same time, different ends of town. And that is coming up on Saturday, October 26th, from 8 a.m. to noon, and
that's both Mountain View Regional Medical and Memorial Medical Center.
Yes, absolutely. These are multi-billion-dollar. These are facilities from multi-billion-dollar corporations that put aside the fact that they are actually competition with each other for just a day to be able to partner with the New Mexico Department of Health and get people vaccinated, and that is a big deal. We can't give them enough credit for putting business aside to put public health first in our community.
And that just goes to show how important it is that we get vaccinated. So how effective are the flu vaccinations?
Flu vaccines vary in effectiveness from year to year. Last season was not so bad. The year before was really rough, and the reason why is a new brew, if you will, of the flu vaccination is created every year. And so this season's flu vaccinations are effective against the top 4 flu virus strains that affected the United States last year, and that is great because that we anticipate those strains will continue, but sometimes Mother Nature has a way of throwing you that curveball.
Oh, yeah.
And that is where, there's a different strain of virus that is not specifically covered by the vaccine, just nails us. And
Just slips through the cracks, kind of.
exactly. I do know that they are working on a universal influenza vaccine, just like a regular immunization, one shot for life and done. But that is still very much in the experimental stage. So here we are, still talking about this year to year for the foreseeable future.
And going back, you named a lot of the convenient places to get your flu shot, if
Right.
you will, and it's free. I mean, you're not out of pocket anything.
That's right.
I certainly found that out. So that makes it even
Anybody
more of a-
insured, really, has no barrier in place to prevent them from getting the flu shot. Many people's trepidation about the flu vaccine could be, that handful of people who have issues with the vaccines in general, or they had a bad experience in years past. For example, the vaccine actually contains a little flu virus in it. So, in years past, it was much more likely to, cause a reaction to make people sick. Like, I got vaccinated and then I got the flu. What's the point? But the point is, you get vaccinated. You get vaccinated before flu season peaks, and it takes about 2 weeks for your body to process those, to build up the antibodies for it. So you're set for flu season, my friend. You are, hopefully going to be just fine.
weather the storm okay. Well, I'm glad you told me that. I didn't realize there was that 2 weeks. I'm one of those folks who thinks you go, you get the shot, and you're all set. But
Right.
I'm glad you brought that up to let people know. So there is a little bit of the flu virus in there, right? Which
Right.
is what
Right.
helps you build up the
And
antibodies
the
against it.
the brews that they've made, really within the last 10 years, they have improved upon it. So people are far likely to get the flu by getting the flu shot. It happens far less often. That said, it does happen sometimes, and it really just kind of depends on the person that is getting vaccinated, and what their health is. Age plays a role. Our immune systems play a role. You could have a compromised immune system in some ways and not even know it. For example, you could be a smoker, but you feel great. And, but still there's just enough something brewing in there that, can compromise the immune system. And, it's really just anybody 50 or older, pregnant, or, their immune system is compromised. They're the ones that particularly need to get the flu shot.
And that's another good point, because it's not one size fits all. Then it's all based on these factors you just described: age,
Right.
the type of health you're in. So I guess people can't go into this thinking that I'm going to get this flu shot and I'm going to be like everybody else.
Right.
I'm going to be, but
It's it's weird when you think about it, because the flu vaccine, in a way, it almost feels like magic. You get the shot, and odds are very much in your favor that you're not going to get sick. At least not get the flu, or get it as severe as you would otherwise.
And that's a point I wanted to bring up and ask you: the severity of it. If you do get the flu after having received the flu shot, may not be as bad as
That's
it
right.
would have been otherwise.
Unfortunately, it depends on the strain. So if it is one of those common strains, it's not going to hit you as hard, because those common strains are what's covered in the annual brew for the shot. But if it's one of those strains that just kind of comes out of left field for us, predicting flu season really is like predicting the weather. You can anticipate a lot, but there are still those conditions sometimes that that are unexpected. It rains harder and longer than initially you thought. That's kind of what trying to forecast flu season and anticipate, which are going to be the most common viruses, and what could sneak around the corner unexpectedly. That's what it's all about. It's almost a never-ending challenge, a week-to-week forecast of trying to figure out who's getting sick with what and where, and the circumstances behind each case.
So there's a lot of science behind it, a lot of, as you put it, and that was a good analogy with the weather guy, forecasting, trying
Right.
to look ahead and try to anticipate, maybe head it off at the pass, if you will.
Right.
How to treat it.
Right, and that can be pretty thankless, because we anticipate in this country. When you hear flu immunization, you expect like 100% blanket,
right.
and to some degree, even as a consumer, I expect it too. But now that I've come to work for the Department of Health, I've learned really a lot about the science of this stuff, and it is an inexact science, like meteorology, like so many sciences out there. There's still much more to learn, much more to discover. Is there a cure for the flu in the long-term future? It's really just about being able to fight those common strains and to be able to help people prolong their lives in the long run.
Okay, David, West Nile virus is something we hear a lot about this time of year, especially with the monsoonal rains.
Right.
Tell us about West Nile, what we can do to protect ourselves against it.
Right. West Nile virus is a virus that's passed to humans by mosquitoes. So, when it rains, when it's the monsoon season, as you said, there's going to be inevitably mosquitoes. Now, this year, I understand we're a couple of inches off from what our average is supposed to be. So maybe mosquito season isn't as bad necessarily in Doña Ana County, for example, as it could be in past years. But nevertheless, where there's rain, there's mosquitoes. And the mosquitoes can transmit this virus. There's no pill for West Nile. There is no immunization for West Nile. It is if we catch it early, there may be some antibiotics there that can help treat the symptoms, but there's no cure for this thing.
Interesting.
And there are two different kinds of West Nile you can get. You can get the kind basically that you got, or the kind that you didn't know you had, kind of thing. You can get bit, and it can just come and go. But the kind of West Nile virus that can kill is the neuroinvasive. Basically, just the virus manages to make its way into the brain. And that becomes a problem because, again, there is no cure for this. There's no real treatment for this. It's really trying to ride the symptoms out in order to survive. And not everybody can do that, unfortunately.
And that's scary that it can
Yeah,
be
and I just,
that
I'm
severe.
listening to myself and I'm like, wow, I'm really painting a picture of mosquitoes, just, being armed and dangerous.
Well, they are.
And in some cases, absolutely. It just really, depends on, what any given mosquito is carrying. So we've had West Nile cases, just a handful of them here in Doña Ana County this year, but we haven't, had any fatal cases, thankfully.
So having said
yes.
there's no cure for it, then it's really 100% prevention. Then really what we need to do is keep from getting it at all. And what can we do to?
It's basically do what you can to be able to prevent mosquitoes from getting to you.
Long sleeve shirts for one. Probably.
Long sleeve shirts, certainly, or long pants, if you're going to be outside around dawn or dusk, because that's when mosquitoes are most active. But that's easy to say, when we're 106 degrees every day.
True.
but it is the most effective way to be able to protect yourself. If you're not exposing a lot of skin, you're not giving the mosquito an opportunity to bite you. But more importantly, it's important to be able to kind of protect the environment around you to be able to prevent West Nile. And by that I mean, just not leave areas of standing water, near your house. If you have little dips in the yard, fill those in so they're level. Flip your wheelbarrows, or empty out the bird feeder, replace the water on a regular basis, because mosquitoes thrive in water. That's where they hatch their eggs. That's where they are born.
And how long does it take? I mean, not long for mosquitoes.
No, it's a super short gestation period for what amounts to a super short life. But you can have a mosquito basically born inside the lid of a bottle cap. There's enough water in a bottle cap to be able to breed these things, and so it's clean up your yard. Make sure that you don't, have any, items that really collect stagnant water to, give these mosquitoes a chance to take hold. If you have, screens in your windows, make sure that they're intact, so no little bug can fly in, kind of thing.
And buzzing around at 2 a.m, like
Right.
we've all experienced, hearing the buzzing close to the
Exactly,
ear.
exactly. I have, 2 cats, and if a fly gets in the house, they don't do anything. But, it's really prevention. That is the key to almost all things in public health, but absolutely true for West Nile virus. And this is a problem that's not going to go away until we have really our first hard freeze down here.
If we get one.
Right. And
Well,
we
typically
usually do.
We get 1 or 2, but
but
they come late in the year.
It takes like November or something.
Yeah.
So if as long as it keeps raining, little drips and spurts in our community, you do need to be concerned about West Nile virus, and it does drag out for us in the southern part of New Mexico longer than it does for those folks up north.
Right. Okay. So let's move on to hantavirus, and that's another big threat. In fact, that's already proven fatal in some cases.
Yeah, hantavirus is very unique actually, because it was discovered in the 90s in New Mexico, and hantavirus has really just killed under 1,000 people in the United States, over a course of now decades at this point. It's actually very rare, but for New Mexico, we're kind of the ground zero for this stuff. It can happen anywhere where hantavirus can spread. And that usually comes from, like, mosquitoes provide West Nile to us. Thanks, guys. Deer mice are the main source for hantavirus. The mice carry the virus, and the virus is found in their droppings. So what often happens is, if you are in particularly a rural area, and you try to do yourself a little spring cleaning of your barn, your shed, your garage, whatever, and you see mouse droppings. The most important thing somebody can do is to actually spray that stuff down a little bit. Don't hose it down. Don't like super soak it, but spray it down
With water?
Just water, to be able, so when you are cleaning, the air particulates don't.
Okay.
It's not stirred
that
up too
makes
much. So literally, it's deer mice droppings, and then when those are stirred, they put particulates in the air. We're talking microscopic. You can't see it, you can't feel it, and then it nails you. And
what are the symptoms, and how do you treat it?
Yeah, well, the symptoms are really very similar to flu. There's going to be some respiratory distress. There is going to be, potential fevers, body aches, chills. Anytime you recognize something's not right here, and after a few days, I'm not feeling any better taking over-the-counter drugs, that's when you need to go see your doctor. And again, early detection is key, as in most cases. Hantavirus, really does attack the lungs first and foremost, and so.
And can that be treated with antibiotics, or what is the treatment?
It can be treated. Oh, I'm hitting my microphone. You can be treated with antibiotics, but it's still a hard slog. It is fatal in a third of all cases. In New Mexico, we've had this year cases, in just McKinley County, which is a rural farming community type county. But it can conceivably be anywhere that the deer mouse is. Doña County is very lucky because historically we haven't had a lot of cases, and in my 6 years with the Department of Health, it hasn't happened, at least within that time range. But at the end of the day, extremely rare everywhere else, but in New Mexico, you need to be careful of this because
And that is
you wouldn't think that droppings, mouse poop would be so deadly, but there it is. And the good intentions of just a good spring cleaning, I'm going to sweep this stuff out, can kill somebody.
Wow.
And it doesn't discriminate by age at all.
So, and with the Oregons and all the hills and mountains we have, people like to go hiking and walking. So is that a threat for the folks who just want to do outdoor activities? Or not so much? Because
Really not so much, because deer mice really aren't going to be hanging around where we're hanging around.
Okay.
We're too big and scary for them. So, as long as we're not, camping in a cave,
Okay,
where they
right.
are, it's not really going to be an issue. If we go hiking the Oregons today, we probably wouldn't even see one of these little guys because they like to stay hidden and and avoid human contact.
That concludes part 1 of our 2-part episode, The Health of Las Cruces. Stay tuned for part 2 on the next ASTA.